Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. How to prevent heart disease. Introduction. Heart disease is the leading cause of death worldwide. You can reduce your risk of heart disease with healthy habits. This program explains heart disease prevention. It talks about ways you can keep your heart healthy. Narrowing of the coronary arteries. The heart continuously pumps blood throughout the body. Blood carries nutrients and oxygen to body organs and tissues. The heart also needs nutrients and oxygen. The heart pumps blood to itself through arteries. The arteries that supply blood to the heart are called coronary arteries. Healthy coronary arteries have smooth linings. This allows blood to flow smoothly. Damage to the lining of the coronary arteries can make them rough. Fatty substances, such as cholesterol, can stick to the rough lining and build up in the arteries. This buildup is called plaque. Plaque and deposits of cholesterol on artery walls usually cause them to narrow. This is called atherosclerosis. Angina, heart attack, and stroke. Narrowing of the coronary arteries can lead to a decrease in blood supply to the heart. When blood flow to the heart decreases, there may be a feeling of chest pain or heaviness. This is known as angina. Angina pain can be felt in the stomach area, middle of the back, arms, jaw. When the narrowing of the arteries is severe, blood flow may become fully blocked. This can cause a heart attack. Rarely, people can have completely clogged arteries without any symptoms. During a heart attack, the part of the heart that does not receive blood dies. This makes it hard for the heart to pump blood to the rest of the body. A heart attack may happen without any physical effort. Symptoms of a heart attack are often similar to those of angina. Other possible symptoms of a heart attack include pressure or squeezing in the chest, shortness of breath or trouble breathing, nausea or vomiting. Sometimes a piece of plaque from a narrowed artery can detach. It can move up to an artery in the brain. This blocks the artery and stops the blood supply to a part of the brain. This is known as a brain attack or stroke. A stroke could lead to coma or death. A stroke may cause sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. FAST is a widely used acronym that can help identify the occurrence of stroke. F is for facial droop on one side when a person is asked to smile. A is for arm drift when a person is asked to raise both arms. S is for speech that is slurred or sounds strange. T is for time to call 911 if any of these signs is observed or experienced. Other stroke symptoms include sudden confusion or trouble understanding speech, sudden trouble seeing in one or both eyes. Other signs of a stroke include difficulty walking or loss of balance and coordination, dizziness, a severe headache with no known cause. Contact emergency medical help right away if you have any stroke symptoms or if they happen to someone else. Treatment can be more effective if given quickly. Every minute counts. Lifestyle choices can help prevent damage to the coronary arteries. Keeping your heart and arteries healthy can help prevent complications such as heart attacks and strokes. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Preventing coronary artery disease. People with certain risk factors are more likely than others to develop coronary artery disease. A risk factor is something that may increase the chance of developing a condition. Having one or more risk factors does not mean that a person will get coronary artery disease. It is also possible to develop the condition without any risk factors. Your healthcare provider will talk to you about your personal risk factors. Some risk factors for heart disease cannot be controlled. Age is a risk factor. Men age 45 or older and women age 55 or older have a higher risk for heart disease. Family history is also a risk factor for heart disease that cannot be controlled. Your risk of heart disease is higher if you have a father or brother who developed heart disease before age 55, a mother or sister who developed heart disease before age 65. There are many risk factors that you can control that contribute to the narrowing of the coronary arteries. The major risk factors for atherosclerosis include unhealthy cholesterol levels, poor diet, high blood pressure, smoking, lack of exercise, stress, being overweight or obese, diabetes, eating healthy. Eating certain foods can increase your risk for heart disease, while eating other foods can decrease your risk. Eating right is an important step to lower your risk of coronary artery disease. You can help keep your heart healthy by eating more nutrient-rich foods and less refined, processed, and fast foods. Vegetables and fruit are good sources of vitamins and minerals. They are also low in calories and rich in dietary fiber. Eating more vegetables may fill you up so you eat less of other less healthy foods and reduce your risk for heart disease. Eating the right types of fat can help you prevent heart disease. Getting the right balance of omega-3 and omega-6 fatty acids is important. Healthy sources of fat include avocados, olive oil, salmon and other fatty fish, raw nuts and seeds. Talk to your healthcare provider for more information. Nuts and legumes such as beans, peas, and lentils are good sources of protein. Lean animal products such as skim milk, low-fat cheese, and lean meats and poultry are also good sources of protein. Limit foods with saturated fat, such as egg yolk, full-fat dairy products, full-fat cheese, and red meat. Avoiding certain foods can help you prevent heart disease. Foods to avoid include fried foods, processed foods such as chips and baked goods, anything that contains trans fat. Trans fat is found in many man-made products such as baked goods, margarine, coffee creamer, and fried foods. Food labels may list 0 grams of trans fat, but if the ingredient list contains the words partially hydrogenated, it does contain some trans fat. Any amount of trans fat is dangerous. Controlling blood pressure. High blood pressure, also called hypertension, contributes to the narrowing of the blood vessels of the heart, brain, and kidneys. It can lead to heart attacks, strokes, and kidney failure. Hypertension may not have any symptoms. It is important to have your blood pressure checked often. Salt can increase blood pressure, so limit the amount of sodium you eat. Quitting smoking. Smoking is a major risk factor for heart disease, lung cancer, emphysema, strokes. Quitting smoking can be hard, but many programs have been developed to help people stop smoking. Talk to your healthcare provider about a plan to help you quit. Exercising. Exercise can help you control your weight and decrease stress levels. This can help lower your cholesterol levels and your blood pressure. Talk to your healthcare provider before starting an exercise program. Your healthcare provider can help you plan an exercise routine that is right for you. If you haven't been active for a while, start slowly and build up the intensity gradually. Ask your healthcare provider what kind of exercise goals you can safely set for yourself. Weight management. Being overweight or obese can increase your risk for heart disease as well as diabetes and hypertension. A well-balanced diet and regular exercise can help you control your weight. Lose weight slowly. Losing weight over a longer period of time may help you keep it off. Your healthcare provider or nutritionist can help you achieve your goal weight. The key to successful weight loss is a commitment to making permanent changes in your diet and exercise habits. Managing stress. Heart attacks are more common in people who do not cope well with stress. Though you cannot always control things that cause stress, you can learn how to manage stress. This can help reduce your risk of heart disease. To manage stress, be aware of the situations that cause it. Once you identify the situations that cause you stress, you have several options for coping. Stress has many causes. You may feel stressed by your routine. This includes stress caused by work, family, and other daily responsibilities. Sudden life changes, such as job loss, divorce, or illness. Avoiding stressful situations can sometimes help prevent stress. If traffic jams upset you, try to avoid driving during rush hour. Sometimes it is not possible to avoid situations that cause stress. Instead, practice making a stressful situation positive. For example, listen to your favorite music during rush hour traffic. Breathing techniques are simple and effective ways of controlling stress. Consciously breathing more slowly and deeply while focusing on the positive can help a person relax. Learning other ways to relax can help manage stress. Many people benefit from daily practice of stress reduction techniques such as mindfulness, Tai Chi or yoga, meditation. Exercising regularly can help reduce stress. Getting enough sleep may also reduce stress caused by tiredness. Seeking support and help from family and friends can also help prevent stress. Knowing your other risk factors. Other risk factors can also contribute to heart disease. A family history of heart disease increases the chance of having heart problems. A high level of LDL cholesterol in the blood or a low level of HDL cholesterol is another risk factor for heart disease. People with diabetes have a higher risk of developing heart disease. Diabetes is a disease where the body is unable to handle digested food normally. This causes a rise in blood glucose, also called blood sugar. If diagnosed early, diabetes may be prevented or controlled through diet, medication, exercise, weight management. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Heart disease is one of the leading causes of death worldwide. You can reduce your risk of heart disease with healthy habits. People with certain risk factors are more likely than others to develop heart disease and its complications. A risk factor is something that may increase the chance of developing a condition. There are many risk factors that you can control that contribute to the narrowing of the coronary arteries. The major risk factors for heart disease are poor diet, high blood pressure, smoking, lack of exercise, stress, being overweight or obese, diabetes. Eating right is an important step to lower your risk of coronary artery disease. You can help keep your heart healthy by eating more nutrient-rich foods and less refined, processed, or fast foods. Quitting smoking can be hard, but many programs have been developed to help people stop smoking. Talk to your healthcare provider about a plan to help you quit. Exercising can help you control your weight and decrease stress levels. This can lower your cholesterol levels and your blood pressure. Your healthcare provider can help you plan an exercise routine that is right for your abilities and your health. Being overweight or obese can also increase your risk for heart disease as well as diabetes and hypertension. Your healthcare provider or nutritionist can help you achieve your goal weight. The key to successful weight loss is a commitment to making permanent changes in your diet and exercise habits. Heart attacks are more common in people who do not cope well with stress. Though you cannot always control things that cause stress, you can learn how to manage stress well. This can help reduce your risk of heart disease. Thank you for using Explain.